Listen, I want you to save money, you want you to save money, and knowing the cost spectrum for the various types of healthcare available helps accomplish that big time. So, let's go through them from the typically least expensive to the typically most expensive so you don't waste hundreds if not thousands of dollars a year. Your least expensive option is going to be telemedicine. Telemedicine allows you to see a doctor or nurse virtually via phone, text, or video chat. Telemedicine companies provide this remote service to treat common, easily diagnosed conditions like cold, the flu, sinus infections, allergies, rashes, and much more. Plus, it's usually less than $75, making it super easy and relatively inexpensive. Next is convenience care, often referred to as walk-in care. Places like Walgreens and CVS are common examples, and they provide quick, in-person medical care that usually doesn't require an appointment. While it treats many of the same things telemedicine can, it provides the comfort of an in-person interaction with a healthcare professional and allows you to get other things like vaccinations, screenings, and other services you need to be physically present for. Next is a good old-fashioned trip to the doctor. Doctor's visits are good when you don't think your condition can be quickly and easily diagnosed, and you want a licensed doctor or specialist to evaluate you in person. Doctors' offices have more size and physical resources than convenience care, and they tend to be great for people that think their condition requires in-depth analysis from a highly trained doctor or specialist. Next is urgent care. Urgent cares help with issues that need attention quickly but are not life-threatening. Urgent care is great when you have an illness or injury like a fracture, cut, severe cold or flu, etc. that isn't an emergency, but also can't wait for regular doctor's appointments. And urgent cares aren't just great for after-hours care. They're open weekends and holidays too, when many healthcare providers aren't. But remember, you're paying a premium for availability here. So if the problem can wait, let it. But if it can't, head to the urgent care. The last and generally most expensive option is the emergency room. You'll know you're at an emergency room because it's attached to a hospital and is labeled with big red letters reading emergency room. The ER, sometimes called the ED for emergency department, is intended to help those in dire need of care and in life-threatening situations like strokes, uncontrollable bleeding, severe burns, poisoning, etc. But remember, the ER will usually be your most expensive option, so only go if you truly need to go. If you can use a less expensive option before you go to the ER, do it. Your bank account will definitely thank you. There you have it, your quick and easy guide to the various levels of healthcare out there. The important thing to remember here is that each of these options has a different level of service and cost. So understand the different levels before you waste your precious time and money.